Hello, this is Dr. Kim Jeong-gil. Today, I will lecture on second-order bends among the causative factors of malocclusion. What are second-order bends? Second-order bends means to the tooth condition on the vertical plane. In other words, when you look at the frontal and lateral view, you observe the extrusion of the tooth or mesiodistal tipping, and so on. When viewed in lateral view, you observe the intrusion and extrusion of the maxillary, mandibular, anterior and posterior teeth and the angulation of the teeth. Also observe the vertical height and the occlusion plane in front. Second-order bends can be evaluated through model analysis and SEEF analysis. When looking at the etiologic factors of open bite and deep bite malocclusion. Open bite is attributed to over-eruption of molar and under-eruption of incisor. And deep bite is caused by over-eruption of incisor and under-eruption of molar. These are all evaluations in terms of the vertical height of the anterior and posterior teeth. Malocclusion can be assessed by dividing it into anterior and posterior growths. The anterior growth can be divided into maxillary growth, maxillary molar growth, mandibular molar growth, mandibular growth, and posterior growth, condylar growth and glenoid fossa growth. The concept of conventional orthodontia is that the anterior and posterior parts grow harmoniously along the axis. Let's look at the case of over-eruption of the maxillary molar. In conventional orthodontics, if the anterior part is large, when the maxillary molar is extracted, the mandible rotates backward and becomes class 2 malocclusion. Or if the anterior part is small, the maxillary posterior teeth are under eruption and the mandible grows anteriorly and can become class 3 malocclusion. In addition, when the maxillary posterior teeth are extruded, the occlusal plane is counterclockwise rotated and becomes a flattened occlusion plane. So the treatment direction of class 2 open bite must be intrusions the maxillary posterior teeth. And the treatment direction of class 3 deep bite must be extrusion of the maxillary posterior teeth. However, in some cases, when the maxillary posterior teeth are extruded, the mandible moves forward and maxilla cannot move forward. This is correct class 3 malocclusion. Therefore, in MEAW orthodontics, if the maxillary posterior teeth are extruded, it may occur class 2 malocclusion, but I think it may occur also class 3 malocclusion. Next, let's look at the case of over-eruption of the mandibular posterior teeth. The maxilla moves forward, and the mandible cannot move forward. Even if it wants to move, it will become class 2 malocclusion. Next is the frontal occlusal plane. When the occlusal plane is canting when viewed from the front, the midline is deviated. Next, we evaluate whether the maxillary central incisor is over-erupted or under-erupted by measuring the distance from the maxillary central incisor to the lip line. In the case of over-eruption in which the maxillary central incisor is lined up, it is expressed as positive, and in the case of under-eruption in the maxillary central incisor, it is expressed as negative. The normal distance from the maxillary central incisor to the lip line is plus 3 mm. If the maxillary central incisor is severely extruded, it may come down to the bottom of the lower lip, which is likely to be a deep bite class 2 division 2. This patient's canine is of a class 1 relationship but shows a deep bite. Yawn to lip line is 10 mm. This patient is in a state where the mandible wants to move anteriorly, but cannot move. Therefore, by measuring the U1 to lip line, extrusion will be required in case of under-eruption, and intrusion will be required in case of over-eruption. MEAW analysis evaluates not only the vertical dimension, but also the occlusal plane. That is, vertical height of the molar and incisor, occlusal plane, POP, vertical dimension, and so on are evaluated. In normal growth is due to extruded of the maxillary posterior teeth, which moves the mandible forward. The occlusal plane for the FH plane decreases and the mandibular plane angle decreases. But the AB to occlusion plane does not change. In summary, in conventional orthodontics it was said that the eruption of the maxillary molars causes class 2 malocclusion due to the mandible rotating backward. However, in MEAW orthodontics, the mandible can rotate backward or move forward. Please refer to the contents of occlusal plane analysis in the advanced diagnosis course of my thesis. There is also a difference between the posterior vertical dimension and the occlusal plane for class 2 and class 3 malocclusion, which are anteroposterior problems. Class 3 malocclusion has more posterior vertical dimension growth, and class 2 malocclusion has relatively low posterior vertical dimension growth. The occlusal plane angle of class 3 malocclusion is flattened with decreasing, and the occlusal plane angle of class 2 malocclusion is increased and steep. We have hypothesized that the leeway space creates a class 1 relationship as the size of the deciduous, molar and subsequent permanent teeth differs as we grow up to date. This explains the occlusal relationship from an anteroposterior perspective. However, I think that not only the anteroposterior aspect, but the other three factors are also important. One is the total vertical dimension and over-eruption of upper or lower molars. And the other is the posterior occlusal plane. In the graph, in class malocclusion treatment, which of the maxillary first molar, mandibular first molar, or total vertical dimension must increase to move the B point forward? The increase in total vertical dimension allows the B point to move forward the most, followed by the extraction of the maxillary first molar, followed by the extraction of the mandible first molar, to compensate for the short vertical dimension in class 2 malocclusion. The mandibular incisors are protrusion or lip protrusion. Therefore, treatment of class 2 malocclusion requires an increase in the vertical dimension. Next is the over-eruption of the maxillary and mandibular molar. Class 2 malocclusion is closely associated with over-eruption of the first molar of the mandibular at the beginning of the Hellman dental age 3, which is associated with the steep occlusal plane. On the other hand, class 3 malocclusion is closely related to over-eruption of the maxillary first molar at the finishing stage of the occlusion, which is associated with the flat occlusal plane. Next is the posterior occlusal plane. The posterior occlusal plane is a line connecting the distabuccal cusp of the mandibular second molar from the cusp tip of the mandibular second premolar, and the angle between this plane and the FH plane is the POP. Class 2 malocclusion is highly associated with steep POP, and class 3 malocclusion is highly associated with flat POP. The initial stage of human facial growth is a class 2 skeleton. But some people do not become class 1 and become class 2 during the growth process. because the vertical dimension does not increase and the steep POP is maintained. In some people, the mandibular adaptation is good, and even if it becomes class 1, the anterior movement of the mandible is overly adapted to change to class 3. Thus, 45 of the population are class 1 and class 2 skeletons, and 10 are class 3 skeletons. In summary, it is said that the occlusal relationship formed during the growth phase is not only due to the leeway space, but also the increase in the vertical dimension and the growth of the mandible posterior occlusal plane. Remember that class 2 and steep POP and class 3 and flat POP are related. In other words, class 2 malocclusion increases the anterior vertical dimension, decreases the posterior vertical dimension, and shows a steep occlusal plane. While the class 3 malocclusion decreases the anterior vertical dimension, increases the posterior vertical dimension, and shows a flat occlusal plane. What is the meaning of the steep POP that is mainly observed in class 2 malocclusion? This patient has a UOP of 11 degrees and a POP of 18 degrees. If the POP is over 15 degrees, it is called a steep POP. Thus, steep POP means more increased eruption of lower molar than upper molar, or mesial angulation of the lower molars. A steep POP may or may not be deep COS, mandibular retrognathism class 2 open. Bite or class 2 division 1 and TMJ may occur. Fukushima said, mandibular retrognathism is correlated with steep lower POP. The skeleton is class 2, but if you have a class 1 molar relationship, you can suspect a steep POP. If only the mandibular molar is mesial angulation, it will be a class 3 relationship. But if the maxillary molar is mesial angulation at the same time, it will be a class 1 relationship. Or, if the mandibular molar is mesial angulation, but rather shows a class 2 relationship, it may be suspected of the posterior position of the mandible. Looking at the midline deviation, one side has little COS, and the other side has severe COS. At this time, the midline is deviated in the direction of the severe COS. First, if you match the midline, you will see that the COS between two sides is different. Right side is observed to be more severe than left side. This patient has a full class 2 relationship on the right and a half class 2 relationship on the left. The midline is deviated to the right. When comparing the midline deviation and the occlusal plane, the side where the midline is deviated is called the shift side, and the opposite side is called the non-shift side. There is no difference in the anterior occlusal plane of the shift side, but the difference in the inclination of the posterior occlusal plane is large. This means steep POP. You can also observe the difference in the inclination of the occlusal plane on both sides of the panoramic X-ray. The right side is more inclination than the left side, which means that the vertical dimension on the right side is reduced. This allows us to observe the midline deviation as well as the difference between the posterior vertical dimension and the POP in different class 2 and class 3 relationships on both sides. On the graph, the y-axis represents the anteroposterior relationship, APDI, and the axis represents the vertical relationship, ODI. If APDI is large, it is class 3, if it is small, it is class 2, and if ODI is large, it is deep bite, and if it is small, it is open bite. Class 3 has a flat POP, and Class 2 has a steep POP. ODI is a steep UOP when it is large, and a flat UOP when it is small. In this way, through UOP and POP, you can evaluate anteroposterior and vertical relationships. This patient has an early loss of the deciduous teeth. A 235 eruption of the teeth is difficult, and the posterior teeth are mesial angulation. Some patients may have a 234 moving backwards. Midline is deviated to the left as the POP of the lower left is steeper than the right. This patient has a tooth 46 extracted and a tooth 47 mesial angulation. The step POP on the right side of the mandible is observed and the midline is deviated to the right. This patient has congenital missing teeth. We can observe angulation of the both posterior teeth. This patient also had missing tooth 35, so the left side on the lower teeth are angulated distal, and the posterior teeth were mesial. At this time, not only the movement of the teeth, but also the condyle can be. Let's look at the case of ectopic eruption. Ectopic eruption can lead to Class 2 malocclusion due to insufficient space for eruption and eruption of the mandibular posterior teeth. In the case of dental caries or improper dental restorations, the vertical height of one side may be lowered. Therefore, it is necessary to treat the balance of the left and right. This patient's tooth 16 has not erupted, and tooth 26 has erupted. Therefore, tooth 46 over-eruption is observed. This will show the difference in the vertical height of the two sides, and the difference in the occlusal plane in the future. In some patients, the second molar of the maxillary erupts late. At this time, when the both second molars of maxillary is over eruption and the mandible moves anteriorly, a Class 3 malocclusion occurs. And when one side is over eruption, midline deviation occurs. So far, we have seen the evaluation of second-order bends. In the conventional orthodontics, only the vertical height of the molar and incisor was evaluated, whereas in the MEAW analysis, yawn to lip line, UOP, POP, and posterior vertical dimension were evaluated together. Deep bite represents of steep UOP, open bite represents of flat UOP. Class 2 represents of steep POP, and Class 3 represents of flat POP. Deep bite and open bite are associated with muscle activity and tooth development, and anteroposterior association with tooth eruption. Thank you for watching.